This is Crystal, this is Cameron, and we're gonna do one way of IV therapy.
Cameron, and I've been doing IV therapy now for about 15 years. And like Tiffany said, there's many ways to do an IV, but we're gonna show you how we do it here in our hospital that we operate in. So let's start off with our supplies here. So first thing off is to have everything out that you need. We have here our 20 gauge needle here. We have lidocaine, which I'll explain as we go along. We have our saline lock, the flesh. We have our tegaderm. We have our tourniquet, our tape, our alcohol gloves, and our disposable hazard waste. So let's start off with tourniquets. If you notice, I like to have 2 of them. You don't have to, and it's not necessary. However, when you apply it on, it goes nice and smooth all the way around the arm. I don't know if you can kind of see that. It goes nice and smooth all the way around. It doesn't pinch the skin like one does. Plus it makes it nice and tighter. So I like having 2 tourniquets. When you have the tourniquet on, just for demonstration purposes, we encourage you don't have to look at a vein. We encourage you to feel. You can't always see every vein. So we encourage you, while you have the tourniquet on, feel for those veins. They're all around. You have your brachials, you have your basilic, you have your anacubitals, your medials, your cephalic. You have so many types of veins that you can feel, and you can't see them, but you can feel them. And it is a good technique to pick up on because a lot of patients will be dehydrated, or they've had previous drug use, or they could be a child and they have very small veins, but you can always feel a vein. All right. So for this purpose here, I'll put on the tourniquet and I will search for the vein that feels the best for me. How do you know it's a vein? It's determined by the rebound. Now, of course, some veins you can see, but if you can't see it, you feel for the rebound. Veins have good bounce, good rebound. Tendons don't have that. And how do you know it's a vein compared to an artery? An artery will have a pulse. And Crystal here has amazing veins.
I have lots.
Yeah, she has really good ones all over. You can see the hand ones here as well. And sometimes it's okay to give it a light slap on the veins, and it helps increase the volume on that vein to bring it more to the surface. And you can see how it just brings it up. Nice. Very nice plush. So for this purpose though, we will go right here. All right. So like always, being that you guys are nursing students, one day will be a nurse, use universal precautions. All right. A good thing to do a lot of times if you're planning to go right here in the anacubital section of the arm, the midline of the arm, is a lot of people have their arms bent. Get your hand behind it and hyperextend that arm. It will push up on that vein to get to the surface. With the lidocaine, I tend to make a mark with the cap at the base of the vein where I can feel it. This gives me a target and a location for my lidocaine, but also for the direction of my vein. Alcohol. Nice little scrub. With the lidocaine here, we don't want to inject in the vein. And this is just a under the skin, bare the skin, and like a PPD, TB test. But I will pull the skin off to the side. You can see the veins here, and I pull the skin right over the side here, so I'm not going to inject it accidentally in the vein. Take the needle, bevel up, and I just make it barely beneath the skin like this. And I do what's called tenting. Tenting is to lift up on the needle, and you'll see it slowly bubble up like a PPD. And this is lidocaine. Lidocaine will help numb. Makes it easier for the insertion, pain-free, and it makes it where the patient won't tense up. So you can see a nice little bubble there. And only give about 0.2. Within just a couple seconds, the lidocaine has already taken effect. Once again, get the arm hyperextended. The most important thing with an IV that I tell everyone is traction, traction, traction. If you don't have good traction, the vein will move around everywhere. So as long as you have great traction, you can do it this way. Some people do that way. I tend to go at a lower angle here and hold it down tight. But that's the most important thing, traction, traction, traction. When you do your IV, go right in the middle of that lidocaine. And when you hit, you get that flash. Drop it down just a centimeter. Push in just a little bit more. The reason why is because your catheter's not all the way in yet. Once you push in just a centimeter, take your finger behind the hub and thread it all the way up. Once you do that, there's different types of how needles work. Ones are push buttons, ones are lock backs. These are lock backs. So you pull back, lock it. Now I can take off my traction because the catheter is completely threaded. These have valves in here, so that way you won't have any blood coming out, so I don't have to apply pressure above it. So I can just pinch and pull. And you can see here, there's no blood coming out because it has a valve.
Housekeeping.
Once you do that, it's okay to clean up the side underneath it. Grab your saline lock and your flush, make sure it's primed. Make sure you have fluid that comes out of it, and we do. Pinch, push, twist. This is where I will pull back on the syringe to make sure I get good blood return. As you can see here, I have great blood return, and then I'm going to push it and make sure it doesn't infiltrate or blow, and it flows nicely. And it's flowing really, really nice. At this point, we have a tegaderm. We call this the shirt.
The shirt.
This we place right over it, just like that. We call this the pants, because it goes right underneath, just like pants. And there's really no right way to tape an IV. It's your preference, but just make sure that it's secure and it's not going to go anywhere. And of course you would time and date it and put your initials on it, but for this purpose we're not doing that for instructional reasons. But that's how you insert an IV. All right, now for the second part, the removal of an IV. In a lot of places, you can actually put alcohol on the tegaderm or the stat lock, and actually will help remove the dressing. These right here are very nice dressing, so I don't have to worry about that. If you take right here, we pull it apart, just like that. And it'll come from the top. This is where I have my gauze. And as I'm pulling back, get the tape off. You can see here, I just do it all in one motion and putting slight pressure here. Once I do that, I will ask the patient to hold pressure. I keep it in the glove, wrap the whole entire IV catheter in my glove, take Coban, wrap it around, not too tight of course, and voila, there you go.